Hi, my name is Barbara Mendez. I'm a student at ASU in the FNP program. I'm going to do a scan of my room. Here's the first wall, second wall, third wall, fourth wall. And this is my equipment. I will not be using a note card. First, with the examination, I'm going to start by performing hand hygiene and donning gloves. Then I'm going to introduce myself. Hi, my name is Barbara Mendez. I'm an FNP student. Is it okay if we do this physical assessment?
Yeah.
Alrighty. So first I'm going to start by reciting the male and female breast exams. First, with the female exams, these exams are performed bilaterally. I would don gloves. So with inspection, I would have the patient sit at the edge of the table with arms relaxed to the side. Then I'm inspecting the breast tissue for color, thickening, and large pores, size, symmetry, contours, retraction, and dimpling. Then I'm going to inspect the nipples and for size, shape, symmetry, rashes, ulcers, discharge, and inversion. Then I am going to repeat all of these steps again in 3 different positions, including arms behind the head, hands pressed at hips, and leaning forward. And then with palpation of the breast with the female, I'm going to have them lay down with ipsilateral hand behind the head. Then I'm going to use the second, third, and fourth pads of my fingers to make small centric circles in a vertical overlapping strip pattern. And I'm going to do this with both breasts, looking for consistency, nodules, and tenderness. Then I'm going to palpate the nipples for elasticity and discharge. Then for the male exam, you can have them sit down or lie down. And then you're going to inspect the breast tissue and areola for edema, ulcerations, gynecomastia. Then you would palpate the breast and areolas for any nodules, and then distinguishing between glandular enlargement and soft tissue enlargement from obesity. Then I'm going to inspect the axilla. No masses or pigmentations. Now I'm going to palpate the lymph nodes. Let me know if you feel any tenderness, okay? Now I'm going to palpate with my left hand for the right axilla. This is the central lymph nodes. These are the lateral lymph nodes. These are pectoral lymph nodes. The infraclavicular lymph nodes, supraclavicular lymph nodes, non-palpable, non-tender. Now with the other axilla, inspecting, no pigmentations, no rashes. I'm going to palpate with my right hand, the left axilla, central lymph nodes, lateral lymph nodes, pectoral lymph nodes, infraclavicular lymph nodes, supraclavicular lymph nodes, non-tender, non-palpable. Now I'm inspecting the chest. Inspecting the chest from the front, the sides, the back. Okay, so respiratory rate is regular, effortless at 16 breaths per minute. There's no signs of respiratory distress, no retractions, no lagging when I walked around the patient. The lateral diameter is greater than the AP diameter at 0.7. All right, so now I'm going to have you sit on this edge. Now I'm going to palpate your back. Let me know if you feel any tenderness. No tenderness reported on palpation. Next, I'm going to percuss using my third finger pressed on the skin with the DIP joints pressed on the skin. My right hand is striking the finger. Okay, the predominant sound is resonance on palpation. Now I'm going to auscultate breath sounds. I'm going to have you take deep breaths with an open mouth. I'm going to use the diaphragm. Go ahead. And I'm using a lateral pattern for auscultation. All right, vesicular breath sounds heard. They're soft, low pitch. Go ahead and lay down. Vesicular sounds were heard on inspiration and fade away on expiration. I'm going to palpate the interior chest. Let me know if you feel any tenderness. Okay, no tenderness reported. No lesions, masses felt. Now I'm going to percuss using the same technique with the third DIP joints pressed on the skin, striking with my right finger, and using the lateral pattern. Okay, the predominant sound is resonance on palpation. I'm going to auscultate those sounds using the same techniques in a lateral pattern. I'll have you take deep breaths with an open mouth. All right, vesicular sounds are soft, low pitch, heard on inspiration and fade away 1/3 of the way of expiration. Now I'm going to check the neck for pulsations. I'll have you turn your head towards the wall. No distension noted, no bounding pulsations. Now I'm going to measure for the JVP, putting the ruler at the sternal angle. The note card is going to be placed at the end of the jugular pulsation at a right angle. JVP is at 2 centimeters. Now I'm going to palpate carotid pulse. 2+, no thrill. I'm going to have you hold your breath. No bruit heard. I'm going to do the other side. I'm going to have you turn your head the opposite direction. Inspecting. No distension, no bounding pulse. Measure the JVP with the same technique. Ruler at sternal angle, forming a right angle. JVP 2 centimeters. Now I'm going to palpate carotid. 2 plus, no thrill. I'm going to have you hold your breath. No breathing heard. Now I'm going to listen for heart sounds with the diaphragm first. This is the aortic area on the right side. Pulmonic area on the left side. Tricuspid area. Erb's point, sorry. Tricuspid area. Mitral area. I'm going to listen with the bell. Aortic area. Pulmonic area. Erb's point. Tricuspid area. Mitral area. Okay, so heart sounds were regular. There was no murmurs or extra sounds. Heart rate 80 beats per minute and regular. And we'll palpate for the PMI, which is midclavicular line, fifth intercostal space. PMI is brief and less than 3 centimeters. Now I'm going to inspect the legs, inspecting the legs from the front, sides, and back. Okay, so thighs, calves, and ankles are relative in size, no edema, swelling. Color, there's no hyperpigmentations, no redness, no pallor. Hair is distributed throughout the legs, some hair on the toes. No edema present. I'm going to palpate bony prominences for edema. No edema presence on legs. Now I'm going to press for pitting edema. No pitting edema, no depression on pressing. Now, nail beds are pink. I'm going to palpate the dorsalis pedis pulse, 2 plus bilaterally, posterior tibial pulse, 2 plus bilaterally. Now I'm going to press for capillary refill. Okay, capillary refill is immediate. Now I'm going to perform hand hygiene. Palpate the popliteal pulses. Bend this leg. 2 plus. Bend this leg. 2 plus. Now I'm going to touch the growing area. Going to palpate femoral pulses. 2 plus bilaterally. Now I'm palpate the inguinal lymph nodes. Horizontal, non-palpable, non-tender. Horizontal lymph nodes and vertical lymph nodes, non-palpable, non-tender. Now I'm going to have you stand up. Inspecting the legs, no varices noted. And that will conclude my examination.